The section on genetics and dysmorphology, you may get asked, for example, what chromosome is affected. You will probably mostly be asked what are complications or associated findings with these syndromes. It's mostly a recognition thing. One of the books that I do recommend, and I don't get paid by these people, is Smith's Patterns of Recognizable Malformations. It's a great book that has pictures, a little bit of text about a lot of these disorders that we're going to discuss. The granddaddy of them all, the most common one, is the Down syndrome or trisomy 21. This is the most common pattern of malformation occurring in about 1 in 660 live births. There are a variety of findings that you'll see with Down syndrome. We're going to see some pictures in a second. Certainly, you'll see a spectrum of mental retardation from mild, moderate to very severe. You will need to remember cardiac anomalies, particularly endocardial cushion defects, also known as AV canals, and we will discuss those in the cardiology section. But there's a very high association with Down syndrome and cardiac malformations. Also gastrointestinal malformations, and the common one that you need to know is the duodenal atresia. We've already shown pictures of that earlier in this chapter. Other malformations, we're going to show you the pictures, include eyes, include the toes, the hands. Here you see the extra chromosome. It's an extra 21st chromosome. And here are some of the common findings that you'll see. Remember, these are syndromes that are a constellation of findings. So you will have the mongoloid slant to the eyes. You can have the epicanthal folds. The eyes seem to be a little bit wide-spaced. Here you can see the simian crease of the hand. Now, about 10% of normal people will have a simian crease. So again, you have to put these together with several findings before you make the diagnosis. Patients with Down syndrome also tend to have a very wide space between the first and second toes. They have what's known as clinodactyly, which is a short, incurved fifth finger. Many patients will have low-set ears. Patients with Down syndromes are at higher risk for hypothyroidism, also at higher risk for atlantoaxial instability. Remember this when you are examining a child for a sports participation physical, such as Special Olympics. Remember the neck and the atlantoaxial instability. That could be a question on the exam. Patients also look for in the eyes what are known as brush field spots. They tend to have a slightly large tongue. They are hypotonic, and the mouth tends to hang open a bit, and general hypotonicity. These patients will also have cutis marmorata. We showed you a picture earlier in the chapter. That is an example of the simian crease. Again, that may be an isolated finding in normal population. It's very, very common in Down syndrome. Patients with Down syndrome, besides the mental retardation and the other things that I have mentioned, also remember a higher incidence of hypothyroidism and also a higher incidence of malignancies such as leukemias. Remember again, it is associated with an older maternal age. Trisomy 18 is the next most common, also known as Edwards syndrome. The way to remember it is 18 starts with an E, Edwards starts with an E. That's one way of keeping them straight. Many times they will notice feeble fetal activity in utero. About a third of the babies will be preterm, a third of the babies are term, and a third of the babies are post-term. Again, these babies uniformly have mental retardation. They will have, on physical exam, a prominent occiput. As opposed to Down syndrome, the Down syndrome babies tend to have a shorter AP diameter of the skull. The babies with Edwards syndrome tend to have a prominent occiput. They also have what's known as rocker bottom feet and what's known as a hammer toe. We'll show you a picture in a second. The hands tend to be clenched with the fingers overriding each other. And typically, it's the fifth finger over the fourth and the second over the third. They also have cardiac anomalies such as ASDs, VSDs. These babies have a very poor prognosis. Only 10% survive to 1 year of age. Down here, this is the rocker bottom foot. You can see. Now, most babies tend to have a little bit of a fat pad, but this is an accentuated rocker bottom foot. And right here, you can just see a little bit of that toe kind of almost flex down a little bit, what they call the hammer toe. This is the typical clenched fist that you see with Edwards syndrome. Trisomy 13, a little less common, also known as Patau syndrome. These patients will have severe mental retardation and will have forebrain anomalies. This is also associated with advanced maternal age. Babies will have midline defects, so they can have cleft lip, cleft palate. They can have these little punched out lesions in the scalp, also known as cutis aplasia, and they have a holoprosencephaly, so that contributes to the severe mental retardation. We talked earlier about colobomas being isolated or being associated with syndromes. In this particular case, colobomas are associated with trisomy 13. Here are some of the findings. Again, we'll look at the midline defects, and you see there's a cleft. They do have some problems with the fingers overriding. Here we have basically almost 2 fingers, a syndactyly, also characteristic feet. And over here, this is what they call cutis aplasia. This is like a punched out lesion in the scalp. This is more of an association. We kind of alluded to it earlier. The WAGR, or W-A-G-R. We talked about aniridia, we talked about hemihypertrophy, and we discussed Wilms tumor. We add the R to make it WAGR, and that would be mental retardation. So we have Wilms, aniridia, GU anomalies, and mental retardation. This is found on chromosome 11, and you will see a picture now of the aniridia. No color to the eye. And here I have an example of hemihypertrophy. It occurs, see here, this leg seems to be more developed than the other leg, and it can also happen with the arms. Patients with, as soon as you see that association of an aniridia and hemihypertrophy, think right away of Wilms tumor. Klinefelter syndrome, again, another chromosomal anomaly. This is an extra X chromosome. So you have instead of XY, XXY. Typically, they have what's called a unicoid appearance. They're very tall, slender. As young children later on, they tend towards obesity. Their arm span is quite long and wide. They will have hypogonadism, so they'll have a small external genitalia, and they tend to have gynecomastia. This is a very important finding. When we talk about adolescence and we talk about Tanner staging, it's very important to know your Tanner staging because it's going to help you differentiate a Klinefelter's from just a child that is an adolescent boy who's developing some gynecomastia as he goes through puberty. Complications of Klinefelter's include psychologic, behavioral complications, as well as mental retardation. On the picture here, you see a tall patient. You can see the gynecomastia right there, and the hypogonadism. Okay, again, very long arms and very long legs. Turner syndrome, very common question to be asked on the exam, and it'll appear at every level. You can see it in step 1, step 2, step 3. You'll even see it on pediatric boards and possibly in sub-board exams. XO, so you're actually missing chromosome material. It'll be considered in any female with short stature. You should automatically think of Turner syndrome. There are other characteristic findings that you'll see, but anytime you're reading a test question and they mention a short stature female, right away start thinking of Turner, and as you read the question, they will start giving you some of the characteristics and you'll know how to answer the question. At birth, these patients can present with a lot of lymphedema, and you will see that they're actually puffy hands and feet, and sometimes progressing upwards, up the legs, and even into the genital area. When they're children, you will see the characteristic wide space nipples, axillary, the multiple nevi, and you'll see the pterygium coli, which is like the web neck, the low posterior hairline. You will notice all these factors as the child grows up. And then once they reach towards puberty, they'll again have short stature and you will not see any of the secondary sex characteristics. Major complications, absolutely remember heart disease. They can have bicuspid aortic valve, and the other big one that you need to remember is coarctation of the aorta. And then as far as urologic or complications, think of renal disease secondary to, for example, horseshoe kidneys. They also tend to have hypertension, and they can be hypothyroid. Here's a picture of a child with Turner syndrome. You can easily see what we call pterygium coli, or the webbed neck. These are very wide-spaced nipples, also known as shield chest. And another finding here is what we call cubitus valgus. You can notice that the arms really don't straighten out very much. This is an infant with Turner syndrome seen at birth. And again, you can see the webbed neck, and you can see the lymphedema of the hands and of the foot. Fragile X syndrome is the most commonly inherited form of mental retardation that's seen. It'll be seen in males, and it's a repeating sequence on the X chromosome, becomes fragile and breaks easily. The major finding is certainly it's going to be in males. I have to remember that. And then after that, remember about mid-face problems. So they will have a mid-face hypoplasia, and the most important thing you need to remember about Fragile X is mental retardation. I have a couple of pictures to show you. Since they have these mid-face hypoplasia, you'll see somewhat wide-spaced eyes and somewhat of a smaller bridge of the nose, or wider bridge of the nose. And they also tend to have a very large head, large ears, and large testicles. So here you see a child with some mid-face hypoplasia. You can see the ears are kind of big just on the frontal shot, but certainly you can see the big head and the large ears on the side shot, and that's not the actual child. This is at an older age. This is an adult, and you can see the large testicles. Remember, mental retardation, big head, big ears, big testicles. That's Fragile X syndrome.